And hello, my name is Rich Coleman. I'm the host for the Prevention Corner, and we are so excited today to be here with our VA hospital personnel, and we're going to provide an overview for you about the services here at the VA hospital, all of the things that we as community need to be aware of and know about to help our returning military veterans. We have had 2 theater wars that our personnel have been in, and it's time for us now as a community to wrap our arms around them, provide them with access to resources, information that's important for all of our community resources, families, our faith community, our outreach initiatives. So if our friends and families don't know where to turn, we're going to provide you some answers today. And resources, telephone numbers, websites, and contact information. Today we are here and we're going to open up with the director for our facility, Robert Mcdivitt. Sir, thank you so much for being a part of our program.
Well, thanks for inviting us, Rich.
Tell us about this fantastic facility.
Sure.
I have just been I live very close to it as well, but just to watch the magnitude of what this facility and serving the population, not only here in Michigan, but throughout Southeast Michigan and Northern Ohio. So talk to us about the services.
Sure, absolutely. We in the VA Ann Arbor healthcare system have a special mission. And as you came into this building, you probably saw it. You saw it as you rode the elevator up here. Our mission statement starts with 3 simple yet powerful words: honor America's veterans. And the way we do that, the rest of it reads, by providing exceptional health care which improves their health and well-being. So we are a system that works in partnership with veterans to manage their health and well-being throughout their life. We have a wonderful hospital here, wonderful clinics here in this building. We have clinics in Flint and Jackson and Toledo as well that provide outpatient care to veterans. We do home care. We do home telehealth, where we have a device that's connected into the veteran's home. We do telephone care. And our goal is that the VA Ann Arbor healthcare system is wherever veterans are. We cared for about 57,000 veterans in this facility and in our healthcare system last year, from the entire state of Michigan, from Ohio, Indiana, and referral patients from around the country.
Mm-hmm. Now, there's been a lot of questions and concerns with a lot of the media coverage about access to care. Mm-hmm. And I think one of the things that we're seeing with streamlining the services and accessibility, that this process is not as hard as someone might believe it is. Talk to us about that perception that we want to dispel that myth. Sure. About we can't get access to care, or we're not quite sure where to go.
Sure. The VA is a system for military veterans, as we talked about. Our enrollment processes are online and easy, and I encourage every veteran in our catchment area to enroll for VA care. It is free, it is easy, there is no monthly premium that goes with it, and if you're eligible for care, you're in the VA system for the rest of your life and can make your own choices as to using the system or not. As you mentioned, we work very hard. We're a system that is organized around primary care. Every veteran in our system has a primary care provider. Our primary care teams are becoming what are called patient-aligned care teams, meaning that each veteran is surrounded by a doctor, a nurse, a therapist, social workers, pharmacists, and other support structures. And the goal of that team is to have same-day access. So we have access to appointments for veterans on the day when the veteran wants to be seen, and have been working very hard over the last years to improve that access. As I mentioned, we do telephone care, we do home care, we do something called secure messaging, where using a program called My Healthy Vet, a veteran can communicate with his or her health care provider and get medication ordered, get advice on treatment, and so on from the leisure of their home whenever they choose to use the internet. So access to VA is not just sitting in the doctor's office having the kind of interaction that you and I are having right now, but there are many, many ways to connect into our system these days.
So when we are working with our families, and I'm going to jump into my role as what I do for our community with my role with Pittsfield Township, and I have neighborhood watch meetings and homeowners association meetings, and we're reaching out to our families, and I have someone pull me aside and say, I was really nervous about something that happened, and I understand about access with my son or daughter to the VA services. And if there is an incident, should I be worried about if I call you, will you help me get to services or assistance that we need? And one of the things that we're really proud of, that with one of the staff, Melanie Powers, who worked with us with
Right.
one of our events,
Right.
was sharing with us about the working with law enforcement.
Right.
And instead of incarceration, if there is an incident, that we work with the VA hospital.
Right.
Talk to us about how important that is, that this relationship that we're establishing with agencies throughout Washtenaw County,
Sure.
but this is nationwide that this program is going on. How important is that?
And Melody is what's called our Veterans Justice Outreach Coordinator. She is a master's degree social worker by training, and her job, as you indicated, has been to work with the courts, and we have established veterans courts in Novi and Oakland County so far. And we have a pending arrangement here in Washtenaw County that we're
yeah.
very excited to move forward with. And the Veterans Court is for veterans who obviously have somehow come into the justice system, but will be given a second chance. And the second chance involves treatment at a VA facility, supervised by the court and coordinated by Melody. And we've had a number of veterans who've been very successful in their treatment programs, working in partnership with the court, and ultimately avoided what could have been
Yes.
a trip to jail or other significant consequence by participating in the Veterans Justice Outreach Program. We strongly emphasize that. I think, as I said initially, our goal is that VA is wherever veterans are, and that includes in the justice system.
So how many I say service calls, that's what we do, but as far as patients, what's your number? How many, as far as this facility, because this is a pretty big facility. How many can you service here? What's that number?
Well, as I said, we serviced almost 57,000 veterans last year. We expect that to grow by a couple of thousand this year, and we may get up in the 60,000 range. We had over the course of last year nearly 500,000 outpatient visits in our facility. We discharged over 3,000 inpatients in our various programs. So as you said, we're an active, busy facility. We're what's called a tertiary care facility in the VA, meaning that we provide higher levels of specialty care. We have very sophisticated cancer treatment programs, cardiac surgery, dialysis programs, extensive medical research programs focused on the needs of veterans. And across the board, if there's a need that a veteran has in our area, it can be met here at the VA Ann Arbor healthcare system.
Well, that's great, because I know that tertiary care is so important with the service that's provided. And one of the buzzwords that we're hearing the most of is the PTSD, the post-traumatic stress syndrome. The mental health services that are also a critical component for the outreach here at the hospital.
Right.
Talk to us about how important that is, particularly from the national, and that it's actually at an international level, but then when we micro it right here
Right.
with our families who bring their loved ones to the facility. How important is it to understand that as a family member?
I think you mentioned the needs of this newest generation of veterans returning from the global war on terror in Iraq and Afghanistan. VA recognized that as well and established a series of polytrauma centers for severely injured veterans, but also realizing that many of the costs of war are unseen and manifest themselves in mental health issues and socialization issues and things of that nature. We have significantly expanded our mental health services here in the Ann Arbor VA healthcare system. Now have over 200 mental health professionals who are employed in our system: psychiatrists, psychologists, social workers, other therapists. PTSD happens to be one of our areas of expertise, and we have regionally, nationally, actually internationally recognized experts in post-traumatic stress disorder treatment here at our facility. We have a large research project in conjunction with the National Guard related to PTSD. We are moving to a system where we will be one of the few providers in the country to provide PTSD therapy by telemedicine. So the veteran can stay in the clinic or in their home even and interact with our PTSD treatment team here. We are part of a national system that has both outpatient and inpatient PTSD services for veterans, work in partnership with our colleagues from the vet centers that provide storefront counseling to veterans. Dearborn is the closest vet center to us here, and have really an extensive network of mental health services available to veterans.
Well, this is really great information to know, because one of the things that we're going to be doing, in addition to putting information up on the screen with website, contact information, telephone numbers here at our local, but also from the national perspective with how you as your family can get the app. I really like that PTSD app. We were working with one of the families in another event that we did that information was brought forward. So I immediately sent it out to like 10 families that I knew right away that needed that information and put it on their smartphones. So those are the types of things that we're going to make sure that we help promote and get out there. Talk to me about your personal experience. What has this meant for you, being a part of the VA system?
Well, I'm privileged. I'm a veteran myself. I'm
And
an
thank you for
Army
your service.
veteran.
Thank you for the service.
Thank you very much. I'm an Army veteran. I would not be sitting here talking to you, Rich, if it wasn't for the Department of Veterans Affairs. I went to school on the GI Bill as an undergraduate and as a graduate student. I've had the privilege to work for VA for 32 years. Wow. This is the 6th medical center that I've worked at in different parts of the country. I can tell you I'm extremely proud of the VA Ann Arbor healthcare system and the services we provide. I also feel extremely privileged to be a veteran who continues to serve veterans, and I think you'll see that in many of our employees. About 25% of our employees are veterans themselves, and nearly every employee has a family or personal connection to a veteran, and I think all of us live that mission of honoring America's veterans every day.
Well, I'll tell you, I'm so appreciative of the work that's done here. And as we were talking a little earlier in our introduction, my father was a World War II vet, and my father-in-law, who just turned 90, is a World War II vet, and we talk a lot about the services, and I share war experiences with him from his time, and it's something that will always be with him, but he understands the dynamic of what's available. And I talk to him quite often about this facility, because if I can get him here, I want to move him a little bit closer to us. And for him to know that the VA services are just this close to us, that's really heartwarming for him to know that the services, if he ever needs it, would be available.
Sure. Well, I hope you're able to get your father-in-law closer here, and we are here for him and for his colleagues and comrades.
Well, Director Mcdivitt, I do appreciate so much the opportunity to spend some time with you and to share about this fantastic facility and the services that are provided. We're going to provide you information on the screen about the website, the contact information, and all of the resources that are available here at the VA Hospital of Ann Arbor, but also serving Southeast Michigan and Ohio. So we're going to be right back with more of the personnel who will be here at our program. And stay tuned to the Prevention Corner. We'll be right back.
Welcome home, man.
And hello, my name is Rich Coleman. I'm the host for the Prevention Corner, and we are here with part 2 of our program and our outreach to provide an awareness and information about the services from the VA hospital here. And now we're going to talk about the services for our returning military vets. And we're going to stay away from alphabet soup and just try to identify the program, because it could get real scary if we start throwing out acronyms and then trying to follow them. But we are with Sarah Nowinski.
Yes,
That's
that's
right?
correct,
Thank you so much for being here with us today. And we're going to talk about seamless transition.
Yes.
Okay? Did that right there? Seamless transition. And this is from our current 2 theaters of war.
It is.
Okay.
It's veterans that served in Operation Enduring Freedom and Operation Iraqi Freedom, and now most recently Operation New Dawn. Operation Iraq transitioned into New Dawn September 1st of this past year.
Mm-hmm. So tell us about how important this has been for you to work with our military personnel.
Well, it's something that I'm extremely passionate about. I think that all veterans deserve optimal, the best care possible, and so the newest returning combat veterans deserve to have their care coordinated and all of their needs assessed, and to make sure that that care is coordinated and a smooth transition, as smooth as possible.
So with the